My name is Zainab Samad. I'm an assistant professor of medicine at Duke University. I have Dr. Prashant Kaul with me, who is an assistant professor of medicine at UNC, and he's also the associate director of the Interventional Fellowship Program. He came out with a very interesting study published in JAMA today regarding inpatient STEMI and outcomes. Prashant, do you want to tell us a little bit about the study?
Yeah, thanks, Zainab. So, we were interested in the differing outcomes in STEMI patients who are already in the hospital. So patients who happen to be in the hospital for some other reason, let's say they're in the hospital recovering from a knee surgery or some other operation, and while they're there, they happen to have an ST elevation MI. And we wanted to compare those patients to patients, the regular patients, STEMI patients that we see who come in from the outside. So we call those outpatient STEMIs. And we used an administrative data set from California, the California State Inpatient Data Set. And from that, we identified about 62,000 STEMI patients and then divided those patients into those that developed STEMI while they were in the hospital, inpatient STEMI. And of the total group, about 5% were inpatient STEMIs and the remainder were outpatient STEMIs. And what we found is that these patients tended to be older patients, they were sicker patients, they had more comorbidities. But even after adjusting for those variables, we found that these patients had fewer diagnostic procedures, fewer interventions, and had over 3 times higher mortality as compared to those patients that came in from the outside as outpatients.
That's very interesting. So with this data set, did you have the chance to look at the time to diagnosis? Do you think that might have factored in how the outcomes end up playing out?
So that's an interesting question, and I think that will prove to be a key variable. Unfortunately, the data set that we were using did not have that data available to us. But we had actually done a prior study, a single-center study at the University of North Carolina, and that did suggest that there are longer symptom to ECG and ECG to device times for inpatient STEMIs as compared to outpatients. So overall, I think the message needs to be that we've made a lot of progress over the last 5 or 10 years as it relates to outpatient STEMIs. The national initiatives, the RACE initiative, the AHA Mission Lifeline, and the ACC's Door to Balloon initiatives. They've all made a significant progress in improving outcomes with STEMI patients, and I think there are lessons that we can learn from those systems and processes that we can now apply to the inpatient setting. And so things like increasing awareness and earlier ECG activation and performance and processes and systems of care such as inpatient STEMI alerts for inpatient STEMIs, I think will prove to be very beneficial for this important subgroup of patients.
Well, that's really interesting findings and a very, very important study, I would say. Congratulations on the work, and I think you guys can look at the study in JAMA and view the video at the Duke Cardiology Fellows blog. Thank you.
Thank you.